Well, hello and welcome to today's webinar, the continuing evolution of telehealth in substance use disorder treatment, key strategies for a thriving practice. My name is Michael Brubaker and I'm going to be your moderator today and looking forward to this time that we have together. I want to share a few thoughts for you. One is just to recognize the project that this training is a part of, and we'll discuss our sponsoring organization later in the presentation. But today's presentation is supported through a Health Resources and Services Administration funded project entitled Serving at-Risk Youth Fellowship Experience Specialty Training. And in this training, we're supporting 48 ethnically and economically diverse social work, mental health, counseling, and psychiatric mental health nurse practitioner students to be competent clinicians preventing and treating opiate and other substance use disorders among at-risk youth and their families. And this project has really been a success only through the effective interprofessional collaborations that we have, and I'm very, very grateful to my colleagues who are part of this project and attending today's session. I appreciate their efforts to achieve our aims together. And I also want to welcome our participating agencies and other professionals really from all across the nation. I understand we have a terrific group today, so thank you all for being here. A few notes for you as you get started. You may be wondering, well, how might I access these materials today? And our team is going to be following up with you, following up with an email today, and that will include links to the PowerPoint slides, on-demand recording, a brief survey, and instructions to claim your free certificate of attendance. So please do look out for that email, and please do complete the survey. It's really important for us as we provide information to our funder, HRSA, about this event and your attendance and your experience here. So again, thank you. A couple things to note as well. So if you need to ask any questions or modify your audio settings, you can do so through your GoToWebinar control panel on your computer or on your mobile device. We are going to have a live Q&A session at the end of the presentation, but if you have any questions as we go along, Nick has been very generous to offer to receive those questions. Those will actually work through a moderator, through me and through some of our team here to get those to Nick, and so feel free to do those, and he'll be able to answer as he can throughout the session. So without further ado, I'd like to introduce our speaker today, Nick Shubiak, and who is presenting our session. He brings over 20 years of experience in direct service administration and clinical experiences to the healthcare field. He's the founder of NSI Strategies, an organization to provide support to integrated healthcare environments, and he currently serves as an advanced implementation specialist for SAMHSA's Opioid Response Network, and also a faculty for the Center of Excellence for Integrated Health Solutions funded by SAMHSA. Nick is the former Assistant Vice President of Addiction and Recovery at the National Council for Behavioral Health and Director at the SAMHSA HRSA Center for Integrated Health Solutions. So welcome, Nick. Thank you again for being here.
Michael, thank you so much. And just so excited to be with you all here today. We have a bunch of fun things, I think, to talk through and get through and learn about today. But I really want to emphasize too that the knowledge and the expertise really is all of us here today. A lot of what we're talking about today is new, and so we are all learning. And so we really do want to invite participation from you all. Michael and my team are generous enough to watch those questions come in. We really want to encourage that, and not just questions, but also you can maybe form that into a comment or build on some of the things that we're talking about. Those things are really welcome here today. And so Michael may be jumping in a little bit as I'm presenting if we have some good discussion, and we'll go into that a little bit. And then, as he mentioned, we're saving some time at the end here together to do some discussion as well. So our objectives, what we're going to be looking at for the next 40 minutes or so together, 35 minutes or so, is really talking about how telehealth is an opportunity to support all of our evolving practices in how we treat substance use disorders and treat people who have substance use disorders. So we're going to talk a little bit about it from that perspective. People, and also how we work with and use evidence-based practices around SUD treatment, substance use disorder treatment. We're going to discuss those promising practices that are right now being utilized by professionals, providers, organizations, and also our clients. Our clients are involved in telehealth work as well. We're going to talk about a real important dynamic around our own wellness and care, which is identifying and reducing telehealth fatigue, and then talk about strategies to integrate telehealth as a tool. How are we going to take this tool that has emerged in a incredibly new way this past year to support the existing great work that you've been doing, and to really how do we provide care in a ever evolving, stronger way. So our telehealth timeline, I think, is helpful to take a look at as we just take a pause. It goes without saying, this past year with COVID-19 has been like nothing else. And so just, an invitation here to sit back and take this in a little bit. So this is kind of our history. So last year, March, COVID-19 hits us and sparks this incredible transformation in all of healthcare and for us in the substance use disorder and addiction treatment field, how we literally deliver the care that we provide in the communities that we serve. And so what many of you out there did was incredible, because you took what we had been, and when I say we, organizations and other federal agencies like SAMHSA talking about telehealth, been trying to implement the use of this tool for the past 10 years, and you all did it, some of you in a week or two. And we saw this shift in regulation where using telehealth was regulated. There was a lot of rules around it. All of a sudden, those things were dropped and gone. And we had access to utilize this tool in very new ways. And so this was critical because we saw how telehealth provided this incredible service that enhanced safety for our clients and also for us as providers and staff. Critical around COVID-19. And we started to see this opportunity, and the talk around telehealth became, gosh, this is going to solve a lot of problems for us. We're able to improve access. We're able to meet our clients in very unique and different ways. They don't have to leave their house. As a person delivering care, as a professional delivering care, I don't have to leave my house. And my clients love it. They love being able to get care from their fill in the blank, living room, bedroom, from their car. We as providers, we heard a lot too. This is great too. I'm saving on commuting. I don't have to go into the treatment center. I don't have to go into the organization, the brick and mortar building. And so there were a lot of benefits. People at home, our pets. There was just this shift of how exciting this was. And then a few more months and things started to shift again, right? And then we started to get feedback, our clients, they don't like it. They can't connect. We can't connect. There were things that we started to realize that just don't translate to being able to do the work that we do in a virtual environment on a screen. And then we found, a lot of our clients, our folks, ourselves, maybe didn't have the proper or correct or any bandwidth to use this new tool called telehealth. And then I find myself working in my own room, and my own office becomes my living room. And how does that work with my family and the people I live with? We started to recognize how we started to actually miss our teams and our colleagues and the support that we get at going to work, making those transitions. And then I joke here that our pets actually were fine with it still. They loved it. They loved having us around. And I think so, we had these two kind of experiences and this is a lot of the feedback that I got from providers and organizations across the country of kind of what was going on. And then I think leads us to this third column here of where what we're learning around telehealth and what we're understanding is now a little bit of a balance between these two kind of shifts, where really we're understanding that telehealth is more of actually doing a lot of the same work that we did in person, even though there's some subtle differences, and we're going to talk about that. And really thinking about telehealth as part of what we do, not transforming completely what we do. The idea that telehealth's not better than in person, it's different, and it has some advantages to it and disadvantages. I think what's really coming out is the fatigue factor, the exhaustion that many of us as professionals in the field experience, being on camera, and a different level of fatigue that we experience and how to manage that. And the understanding that, you know, this new tool is going to take some time. And we didn't have the time that we needed to get comfortable with the technology. We kind of had to just implement it. So we're still in that learning process. And then time, how do we work with our team? How do we maintain those collegial relationships that are so critical to providing care the way that we want to? Same with our relationships with our patients. And ultimately, how do we build, how do we maintain those relationships across the board? So we're gonna get into that a little bit. But I think we're gonna start now. Actually, gonna check in on a poll question, and Misty's gonna go ahead and put this question up. And the question is just to kind of check in for us to get a sense of, for all of us, of our audience, all of us. Where are you? Where, you know, your organization on the telehealth timeline? Have you not started yet? And so this is new, we're information gathering here, or are you doing telehealth and we've been doing it before COVID hit and we're really looking to actually elevate that? Or was, you know, COVID hit, we transformed, and now we're looking to elevate our utilization to get better at doing it, or something different, you know, different experience for you altogether? So I know we're going to give this just a few minutes, and then Misty will be able to show us the results of that. So great, so here we go. So our poll results are that it looks like about 11% of us haven't started yet. Okay, great, so there's some folks out there, we're gonna have some information for you. Some folks were doing telehealth prior, helpful to know. Looks like most of us started after COVID, right? So really in that care delivery transition group that I talked about a little bit, of kind of not doing it to all of a sudden, probably in record speed transitioning to do it. And then some folks are on a different continuum altogether, and we would love to hear from you in the questions as well. Great, thanks Misty for that. That's really helpful to see and to understand our audience, so we all kind of get a sense of that. So as we talk about telehealth, right, the other piece too is how does telehealth plug into a framework that we already have, right? And so I'm going to talk about telehealth from organizational perspective, from providers' perspective, and also from the patient perspective. And when we talk about organizational capacity, this is a way to kind of look at the complex dynamics of how organizations work, right? And we know when we're talking about any initiative, when we talk about the administrative team, we know that we have to have buy-in from our leadership. We need support from that. We need the direction that our leaders give us, and also the resources that we're going to need to execute it well. The other piece, as we think about how telehealth has impacted our medical team, our behavioral health team, and our clinical pathways and our patients, is how has telehealth impacted our organizational capacity? Thinking about this and looking at this, how does it fit in? So I look at, say, you know, depending on the organization, the organizational structure, you may have some of these buckets, you may have more buckets, but looking at the medical team, telehealth's going to challenge, does our medical team understand how our clinicians, how behavioral health, how our addiction treatment providers work, what they do? Are we integrating that and integrating the telehealth tool? How do we make those connections in the telehealth virtual environment? And then we cross over to the other behavioral health team. thinking about our skills as clinicians and as counselors. Our communication skills are going to be challenged in telehealth. Does this change our approach to treatment from maybe a more reactive approach to a more proactive approach where we're reaching out to our client base more? Does it challenge us to communicate, learn, and understand and be able to diagnose signs and symptoms in new and different ways? How do we document the telehealth environment? Is it different? Are we able to address and look at comorbidities, which is such a critical part of the work that we do in addiction treatment? And really looking at ourselves as counselors, maybe stepping out of our traditional role into more of a leadership role on the team, bringing our team together in the virtual environment. And then back over to the left-hand side, how are we integrating? How do we integrate these fantastic critical resources that I know many of you are utilizing, like peer supports and recovery coaches? How are we integrating our community resources? And then looking at our patient, how are we working with our client? How do we deliver screening? How do we deliver and collect data? Utilizing evidence-based practices and interventions in the virtual environment, and then really connecting with our resources and connecting our resources with our patients. So all of our organizational capacities being challenged and looked at a little bit differently through the telehealth lens. So another poll question for us, just to get a sense again, and Misty's going to go ahead and put that up for us for some feedback. And we're going to ask the question, in regards to telehealth, I am most excited to explore, and we just want to get a sense of kind of what you're looking for to look at. And the question is that you can choose from is the organizational component of this, so the organizational impact of telehealth, the client experience, the counselor or provider experience, or is it all of the above? And I don't know if we have this set up as a poll. It looks like in the chat, Misty said this is we can go back to it, Misty, if we can, or you can pop it up at any time so we can check in on that. And we'll just keep moving forward. So when we think about going back, because that's what's really coming up now, I think, and things are changing so fast for us, right? Things are starting to open up across the country. We're starting to get back to normal, right? And so now's the time to start thinking about post-COVID. And how do we take this resource that's been brought to us, telehealth? Most of us talked about how really this came to us. This is the lemonade of the lemon of COVID, that this tool was brought to us, is how do we go back to normal, but bring this future in? This is the future of how we're going to transition into telehealth care delivery. And so we're really talking about going back to the future and bringing this future experience with us back to whatever our normal is. And so looking at organizational readiness, are we ready to bring this tool back into getting into whatever our new normal is in a way that's going to be a support to patients and to the staff? And so some of the things that we need to think about in terms of organizational readiness is this tool going to require new staff and new positions? And really, this is around information technology. Do we need roles like IT navigators, not just for staff, but also for our clients? This requires a skill set that many of us as providers or the clients that we serve may not be familiar with. We've seen a transition that over time, and we're going to get into that in a little bit later, but we may need support around using this technology in the most effective ways. And then there's going to be breakdowns, right? Before we did this webinar, Misty and Michael and I met, and we have a backup plan. What if lightning strikes and my audio goes out and all we have plans of what's going to happen if the technology breaks down. If we're going to ask our addiction treatment centers to use telehealth, have we provided the training of I know what to do if it breaks down? Do I have a plan B, C, and D? Does the patient have a plan if their technology is failing them? And so simple things like creating policy, procedure over who calls who back and what do we do are some of the critical components of starting to build our organizational readiness to effectively use telehealth over time. And so we're also, from an organizational perspective, looking into our clinical pathways and care delivery. So again, telehealth has changed how we're delivering care. Looking at our integration of the telehealth environment and the physical environment. How do we share space? What is that space? That space is now maybe virtual. Can we transition between virtual and physical? And can I share that room with another provider? Or when the person checks in at the front desk, so all that way, and when we talk about clinical pathway, it's how does the patient get to you? How do they receive the care that they get? And so starting to ask these questions in terms of our organizational readiness is critical. Looking at the way we schedule, the way we pass and warm handoff our clients back and forth between the different departments that they may utilize in ways that we maybe never even thought of. You know, as a clinician, I may just kind of walk into a room and everyone kind of shows up and walks into that room and is ready to start a group, but I'm not connected necessarily to what happens when they walk in the door or they check in or they get walked back to that room. And so starting to operationalize many of these things in the virtual environment are so critical. And then also too, how do we connect with our colleagues? Those curbside consultations that we grab in the hallway or connect with our colleagues to discuss a specific case, patient, or issue, so critical, right? We rely on our teammates. Is there a way to do that in the virtual environment through telehealth? And so that's not just important for good clinical care, but being able to connect with our teammates and our colleagues is also about provider wellness, and also speaks to part of how do we maintain our professionalism, how do we maintain our own energy, our own provider and personal wellness. Those are things that we need to be thinking about in terms of our clinical pathways and our care delivery. Also too, really shifting into and thinking about, is the type of evidence-based practice that we use appropriate for telehealth? Maybe we need to be shifting, thinking about more solution-focused skills for our clients, potentially shifting our treatment approaches to increase maybe the amount of sessions and interactions we have with them while decreasing the duration that we have. You know, we see this in the neuroscience of substance use disorders in terms of understanding now how that impacts the capacity and the ability of people with substance use disorders to concentrate, pay attention, plan, all those executive functioning issues. And so really revisiting our MI skills for change with our clients. And a real big emphasis on getting back to small steps, small increments, may be really critical. So the other big pieces that came up when we talk about the operational perspective in telehealth was the concern and safety of our clients and being able to keep them safe. And so these were some of the big issues that came up over the past year. Risk and concerns around suicidal ideation or homicidal ideation. Some of the key things to think about if you're operating in a telehealth environment is that to be mindful that 911, when you dial it, may get your local number. That may not be the local area, depending on how your catchment area for your patient population and client population, that may not be the appropriate jurisdiction for that client. So you may need to call the patient's local number or client's local number. And so that's just one of the important things that came up and lessons learned. The other thing is, it's really important that we use an evidence-based assessment tool around suicidal ideation. Many of you are doing this already, but practicing and learning it to do it in the virtual environment, it's much of the same. In fact, it can even be better at times because you can use things like screen sharing, so you can work concurrently with the patient or client. But utilizing that is really critical. we have some links to those assessment tools as well at the end of the presentation. Also, when we think about safety planning, really the good news is you're not doing it much differently. You're handling it in the same way as if you were in the room. You're looking for those protective factors, and really moving towards not reacting and calling the emergency department right away. Many of these, as you all know, many of these situations can be addressed with proper safety planning and effective safety planning. May also include wellness checks, using a patient-centered home model where we're reaching out to patients in a way, clients in a way, to check in them, and then looking at how can you structure and provide structure for our clients to help keep them safe. Remember, COVID, the impact of COVID, social isolation has limited many of the already limited resources for clients. So it may require some additional structure development with our clients to help keep them safe. The last piece around this is proactively getting contact information and checking for accuracy. Verifying the callback number, a really important thing to do. Sometimes, we really need to be proactive in checking that safety, those safety numbers in the client chart. The other complexity comes up around, what do we do around when a patient's intoxicated or going through withdrawal? Well, again, the approach is much of the same of what you would do if the patient was with you. You want to be using those assessment tools like the COWS or getting a CWA score, but really your approach to that is not going to change all that much. Questions around urine drug screening and testing. Really, we may not be able to get the normal amount of data back that we're used to getting, so we may want to increase patient education and risk factors, especially around opioid use disorder, right? Because we know the risk factor for overdose death. Maybe it's an uptick in utilizing, educating, prescribing, giving access to naloxone, and really talking to our patients about naloxone so that they're aware of it, they understand it. And then for prescribers, we may need to look at prescribing maybe smaller quantities, but not dosages, right? We're not talking about reducing dosage. We're actually talking about just quantities of medications. So those can be some key factors. And then really thinking about, do we need a support team? Do we need that IT navigator? And some to help with client challenges around connecting to Wi-Fi or helping them get their I couldn't get my audio to work when we first logged in, but Misty was able to help me do that. Well, as a provider, we don't want to be using clinical time to solve some of those problems. And again, getting our teams back at working at the top of their licenses. And so taking on those roles may require additional staffing and support. So when we operationalizing from a clinical perspective is that for documentation in the telehealth, again, much of the same, it's similar. What we really find is most effective that has really been a push in the field is utilizing collaborative or concurrent documentation. And what that means is that we're literally writing our notes, developing treatment plans hand in hand with our clients. They're looking at the same screen that we are looking at. And telehealth opens up this opportunity in a very new way because we can use things like screen sharing to allow our patients to see what we're literally writing. This can be challenging for a lot of us clinicians. We're not used to documenting in that way or even sharing information in that way. And so that's something to look into in terms of there's a lot of resources out there around collaborative documentation and building that skill set, because it may be really important for you also to be efficient in terms of being able to get your charting and your noting done. The last piece around concurrent documentation that really is key is that we utilize the documentation in a way that really helps with provider burnout. If we can document our notes while we are with our clients, what that does is it helps protect me and insulate me from re-exposing me to the session. If I have to write my notes later, I literally have to put myself into an intellectual, cognitive, and emotional place where I think about and experience much of that session again. That's how I gain access to the memory to write the note. If I don't have to do that, I'm decreasing my exposure to secondary trauma. And that can be really important for us in terms of our own wellness. And then I bring up at the bottom here, do we really have the emergency contact? Really, that when we use telehealth, what we have to really make sure is that those charts, that demographic information is accurate and up to date. So for those of us just getting started or somewhat on still the trajectory of getting telehealth up and running, I created a startup toolkit with a group of colleagues. We started this and did it basically in a month or maybe even weeks. But this was asked of me from the field. I had colleagues saying, look, we need to get this going and we need to get it going now. We need help. Give us direction. So I developed a startup toolkit. It's accessible, as is the other resources on the NSI Strategies webpage. You can go to nsistrategies.com, click on telehealth. It'll bring you to a page where you can download all these resources. But that startup toolkit includes a lot of pieces of what we talked about to help support you. So we're going to shift gears now, and now we're going to talk a little bit about telehealth from the provider, from the counselor, from the professional experience. And so what we did is we created a telehealth checklist to help support our providers ready themselves for delivering care through telehealth. And the idea behind the telehealth checklist is that it creates a structure for us that helps put us in a state of regulation. The stress of logging in, of being able to get the screen the correct way. We talked about the challenges with the audio, the video, the technology. Dysregulates us. And then we have to do our work. We have to do our work as a clinician. And so remembering that you are out of your normal workflow, that's part of what has been contributing to the exhaustion that you've been feeling the last year. So creating structure helps our brains. It helps us use less energy and starts to make what we now very consciously and with great effort have to do, it starts to turn it into that's just how we do it and become less deliberate. And so some tips around creating that environment and that structure is proactively thinking, like, what am I wearing? How do I look on camera? Do I look professional? I have some shirts I can't wear because it makes the screen get all zigzaggy, and it's disruptive. So being prepared on how you dress and how you look. Also creating a do not disturb sign. Before I started this webinar, I put a sign, because I'm working from home, that please be quiet from 2 to 3 on a webinar. And so that's part of my checklist before I log on. Also keeping the same routine. So thinking about how you are as a professional when you go into your treatment center, you kind of have an on stage and an off stage. Well, same too when we're on camera, off stage, on stage, making that a purposeful shift. Do a video background check. Look behind your background. Are there personal things that you're concerned about that you don't want folks to see? And if you can, use earbuds. They help in terms of cutting down our fatigue because they help us hear better and our brains have to work less hard. The other pieces are knowing who our technology point person is, and really just looking out for our confidentiality, because many of us may be doing work from home, and so are there personal things or items. So the idea behind the provider checklist, and again, you can download this and keep it at your desk or until it becomes part of your own ritual, but the idea is that you do it every time. So this just becomes how you do this work, and this creates a structure that your brain's going to really like. The other thing, from a provider perspective and professional perspective, is that a lot of us are doing groups, especially in substance use disorder treatment. Groups are, for many of us, the main way that we deliver care. And so we found that much of the work is really doing it the same way. The norms of the group stay the same. Helping getting our groups ready, our client readiness can be really effective. Using the mute option of having everybody on mute as they come into the meeting can be really helpful to cut down on background noise, which can be really frustrating. and also using the chat icons, the chat feature or the icons as a way to communicate. Those things are really effective and help support and increase levels of engagement. Encouraging our clients to stay on when they can video, but knowing too, depending on bandwidth, sometimes they have to go off. So maybe depending on your culture, your community, having that option of on off can be really helpful. And being mindful that not everybody can be on camera, and so not necessarily judging that as a level of engagement or participation. Ultimately, when it comes to us in telehealth, is that you make the call. You decide whether it's appropriate to use telehealth with the client or not. And that's going to be a big part of as moving into the future of how we think about integrating telehealth. Not all the time is this going to be the most effective way to use telehealth. And so acknowledging that as a clinician is going to be really important. The other piece is our rapid assessment skills. And really we have to revisit these in the telehealth environment. Coming from a trauma-informed care approach is really important. Telehealth brings us back to a great reminder to utilize those. How are we going to open up our visits and start to create that structure with intention and awareness, right? We're out of our normal workflows. And so how do we continue to develop rapport? It may challenge us in our diagnostic skills of asking probing questions, right? In ways that we do it in a way that invite those open and honest responses to talk about what's truly going on. And really utilizing shared care planning, those approaches that we talked about, may need to change a little bit our goals and our treatment planning, and really thinking about how do we shift to kind of match maybe some of our old treatment planning modalities with some of these new short-term briefer interventions that may be necessary to help support our clients and where they are. And that's a lot of the feedback that I've been getting from providers across the country around some of the shifts that have been helpful in telehealth. Some of the other things to think about is scheduling and rescheduling in the moment. Are we able to integrate that? Again, sharing the telehealth space with whatever process or operation we have to keep our clients connected to our treatment center. And so as we move into kind of our clinical approach, we're going to go through the tenets quickly of trauma-informed care, of trust and transparency, and really revisiting the idea of giving as much control as possible to our client. And so asking questions like, before we start, is there something that you want to check in on, or is there something that you want to talk about today? So sharing control over the treatment plan, over the service plan that you're working on, and really integrating your motivational interviewing skills. The other piece is collaboration and mutuality, right? So connecting directly with our clients. You know, how are you doing? How are your family doing? What do you need? Leveling that power differential. Providing those supports and affirmations. You're doing a great job. Great job making it here today. The idea here is that we remember that our expertise is around substance use disorder and substance use disorder treatment. Our clients' expertise is around themselves, their families, how they've been impacted by COVID-19 or whatever else is going on for them, and what it is that they need and they want to work on. And so we really dive back into our MI spirit of providing care in the telehealth environment. And so we focus on empowerment, voice, and choice. And this may mean doing more of this than we typically have had to do in the past because the higher levels of stress and the impact of what's gone on in our communities the last year. So consider educating patients about grounding exercises like diaphragmatic breathing, or using movement as a way to get grounded, talking about how to improve social connections. And as clinicians, we shift to truly listening to understand, not to respond. Listening to understand, not to direct, not to tell. And honor what we hear by really offering possible alternatives, embracing the assumption that everyone out there is doing the best that they can. That really helps us stay in the MI spirit of a strengths-based approach. And we know on the right-hand side here, helping enhance these pieces are stress busters. Those supportive relationships, exercise, healthy sleep, nutrition, all the things that you know. Well, we may need to be supporting our patients to do a double dose. What used to work a year ago or 6 months ago or right now, I may need more of. And then making sure that we bring in our cultural, historical, and also gender issues, that we are bringing those in a way that matches our treatment interventions. So being curious with our communities, how has the pandemic impacted our community and those differences? And being curious how some of the systematic approaches to this crisis have marginalized certain populations. These are our folks that we work with, right? And so really engaging in practicing and in cultural humility. And so this brings us to our next poll question. Well, Misty, we'll see if this one's working. And we're curious to know, have you seen a shift in how well your clients are able to use telehealth? For those of you who are using it, have you seen, since you started using it and now, are our clients getting better at this? So we'd like to know, yeah, hey, yes, clients are more comfortable and better than before, or no, not really. Our clients have challenges, or somewhat. Our clients have mixed reviews of telehealth, or nope, there's something different. Nick, you didn't catch what we're doing here. So we'll just pause for a moment and let folks fill this out. Okay, cool. So have you seen a shift in client proficiency? Yeah. So 23% are saying clients are more comfortable getting better. Some not really, and somewhat. Clients have mixed reviews of telehealth, and that 65% has been my experience as well. The folks that I have had the privilege to work with is that, yeah, it's mixed. There's some positives and there's some negatives. Misty, thanks for that. That's really helpful. So we'll go ahead and we will. I think I have. We'll move back on and so this is also a picture of the web page. The tools that we talked about in terms of guidelines for your organization, for us as providers and professionals, and also we're going to talk about for patients are available to you at the website. So you can go ahead, it's a PDF, and just download those. They're there for you. We're not going to go through all of this. I'm going to talk about these in summary because you can download these and take a look at these. But what we also realized is or readying our organizations, which we talked about. It's preparing ourselves as providers, creating our checklist and getting ourselves ready to deliver care in this new way. But also too, how do we support our patients? And so when we started this in our clients, so when we started this like, a year ago, I was working with colleagues and they're like, Nick, we're doing telehealth. We got folks showing up in all sorts of clothing and pajamas, and some folks are walking around Walmart, and like, how do we manage all this? And so we put together, based on a lot of that feedback, some guidance and some support for our clients. And so this is how it's split into two areas. The first one is preparing space. The second one's preparing yourself. So as a client, preparing your space for your appointment, this is a good checklist for our clients. Is your phone working? Is it plugged in? Do you have battery? Are you in a place, or can you get to a place that has reliable internet connection? While some of these questions may seem obvious, they're important reminders for our clients. The other piece is confidentiality. Are you in a comfortable and private place? How do we check in around that? Can you test your camera, test your speaker, turn your device off for alerts and notifications, have a pen and paper ready. And then letting the client know, hey, we're going to be visiting you in your environment. Is your environment ready for us to come in? Are there things around that you don't want us to see to support your privacy and your confidentiality? And then for the patient themselves or the client themselves, preparing themselves for the appointment. What do you wear? Well, please wear the same clothes that you'd wear when you come to our organization. We want to make sure everybody's safe and everybody's boundaries are kept. And where are you to be for the appointment? Well, make sure you're in a comfortable place, a seated position, and that you're confident that you can speak freely, that you feel comfortable there. And some other ideas, maybe bring medication, bring any devices that you may need for physical health if you're collecting that kind of information. And then there's a checklist that can be really helpful. Completing a list to be ready to answer some of these things. Like, what questions does the client have? Or have they changed medications or any shifts in that? What difficulties am I having? Are there any symptoms I'm experiencing? Is there any kind of feedback, or what are my goals? What are some of the things that I need to do next? So this creates a structure which really helps regulate our clients. So we've seen, and we talk about that mix, some of the benefits of telehealth, that we know access to care can be faster. We've seen that, right? And we're seeing also the opportunity of how we can bridge the gap of missed appointments. Also, too, hearing from a lot of clinicians, patients feel safer in their home. They're less guarded. Sometimes sessions are actually more effective to talk about some things that normally they wouldn't talk about in the treatment center. We know the effectiveness of the reduced risk of viral transmission, so it's a certain safety precaution. We've seen how weather-related issues have been mitigated by telehealth. They are a bridge to our clients when they themselves can't make it to our organization, and really an opportunity to bridge some of the social determinants of health, transportation issues, financial issues. Those are opportunities that telehealth brings us in bridging some of those gaps. So really, telehealth, it got us through this last crisis, but it's about also integrating to prepare us to be better for the future. So starting to really think about, how does telehealth support the work that we do? How do we integrate this new tool? Knowing that's not going to replace the brick and mortar organizations. We need them, they need us, they're here to stay, but how do we bring telehealth into them? Starting to think creatively, do we use telehealth to impact the things that we know impact care, which are cultural dynamics, transportation, access, our own wellness, burnout, compassion fatigue, and do what we do better? Where are the opportunities to help support, build social recovery capital? And really thinking about, well, telehealth, it may not be the best way, but is some care better than no care? And the answer to that is yes. And so how do we use this tool to bridge those places that formerly would have had no care? And so telehealth, we know, also has put an extra level of stress on our workforce. So we want to get a sense from you all. Where are you at? And I think, Misty, this is a poll question that that we're going to put up. In terms of thinking about yourself or your workforce, has telehealth has put an extra level of stress on our workforce? Yes, no, or it's complicated. Yes, meaning, yeah, we're concerned about burnout, compassion fatigue, or no, telehealth has helped reduce burnout and compassion fatigue, or it's complicated. We just love to get it. Oh, yeah, that one's not working. Thought so. So you can put that maybe in some of the questions or some of the other ways that we can communicate. We're going to kind of wrap up and then move into questions here. We asked that question because we somewhat know the answer. It's been an exhausting year, and important for us to. I saw this tweet that came out right around the onset of COVID, and I thought it was so dead on. It's from a clinician at the University of Pittsburgh, Dr. Hallion, and she says, "Hey, can't concentrate on work? That's normal. Our brains pay attention. This is how we're wired to scary things. This is what helped us keep us alive, away from the lions and tigers and bears when we were in the cave. So if you can't concentrate, buckling down, gripping down, and trying harder is not going to help you. And that's just the science of our nervous systems. So as you're stressed out and struggling, it's not your fault, and it's not because you're weak. It's the neuroscience of stress. Why are you zapped? Well, because during COVID and using new tools and any kind of change like telehealth has the potentialities to shift you from a healthy level of stress to a toxic level of stress, distress. And our natural response to stress can energize us, it can motivate us. When we shift into distress, it exhausts us. And so we really need to be mindful about managing and doing things to support our own resiliency and bouncing and ways to bounce back to balance. And 3 ways to do that, just as a reminder, not just for our patients, but for ourselves, is top down or bottom up, right? So using our cortex, really becoming aware of what kind of story am I telling myself? What are the thoughts that I have right now? Using techniques around mindfulness, using mantras, knowing that this is temporary, this will not last forever, and then shifting into the bottom up part. So exercise, walking, focusing on breathing, things like music and dance, these are the things that help regulate us. And then third is our relationships. And we talked about how telehealth challenges that. How do we reconnect? How do I connect with all of you out there, right? As I speak to this screen, hopefully we have some questions. We have some Q&A. How do I connect with those relationships, right? And the idea and the remembrance that if you're doing your work, that we know from science, it is scientifically impossible for a dysregulated person to regulate a dysregulated person. So it's the cliche, right? That sticks. The oxygen mask, we have to put it on first. If you're interested in some more information around this self-care and building resiliency, you can also go to the NSI Strategies website around resiliency. There's some tools here for you. There's 3 webinars on the 6 steps towards becoming a resilient leader that I think you might all find helpful. These were also developed. And then finally, I'm going to wrap up here and we'll go into our Q&A. A reminder that you're doing your best. We're all doing our best. Our colleagues, our clients, and ourselves. So thank you. Thank you for the work that you do. Thank you for doing the work that you do in some really difficult, challenging systems that you do the work in. You bring the health and the wellness to the communities that you serve, to the colleagues that you work with. And so thank you for doing this where you do it. You don't get to hear this enough, and so I hope you hear it from me. So I think we're going to move. Thank you. This is my contact information. Folks can reach out to me. Michael, I think I went a little over, but we have some time for maybe some questions and comments.
That was fantastic, Nick. You just gave us so much rich information here. I mean, I was just taking notes right and left about new things that I want to follow up on now, and so many terrific ideas.
Awesome.
I'm not going to ask you any of my questions, so I can do that another time, but we have some that have started off here that Misty has sent to us. There's one question, just a clarification question about 0 to 0 psychology. Could you explain what that is?
0 to 0 psychology?
Yeah, I think that
I actually don't know what that is.
Okay, so that might have been kind of a comment that we might have misheard in here too. The other question was about credentialing across state lines. And so the question, which is always a great question, and this is another, it's caused us to rethink our practice, right? So if I'm the question came in is, if I'm credentialed in one state and I go out of state to another state, am I allowed to do group and individual counseling for my client in the state and state I and the client reside in?
All right, watch me wiggle out of this answer.
Yeah,
it depends on the state. And it is complicated and confusing. So I want to just validate that, Michael. The resource that one of the websites that's in the slide deck is a great place to go to try and also if you download the toolkit, there's a resource page where you can go to that provides links to websites that are continually updating some of those state regulations. That's where I would go to try and find the latest and ever-changing regulations. It depends by state, and it can get complicated. And so I would go to that resource.
That's great advice. That's a terrific advice too. And I believe some of the associations are providing some guidance in here too, but it sounds, to have a nice central location like that, that is terrific. So thanks for
putting that
For sure. Now, there's one other question here too, which I think has really been amplified, and we've talked about this in the COVID crisis in general, but it shows up in telehealth here as well in terms of some of the cultural disparities, but also in terms of disability. So, question comes in: how can I prepare for accommodations based on medical need for patients and/or staff who would utilize ADA while receiving or providing telehealth services?
Yeah, that's a great question. I'm not, and I don't know specifically how to answer that question. I do think that some of those resources again would be really helpful around ADA. I do think though, telehealth, actually to flip that question around a little bit, is a really potentially fantastic answer to delivering services in regards to ADA accommodations, because it gives us so much different opportunity of how to get our care to the client versus requiring the client to get to us. And that's one of the I think, really exciting parts about talking about integrating telehealth into our existing organizations. So that's kind of how I think about that, Michael.
Yeah, that's I wonder if there are many people who are starting to use, there's so many things, like if you do a video or anything on Google, it'll start working on that transcription for you. And I wonder if there's services that are being provided within more secure and HIPAA compliant platforms that are doing that type of work just for this, or if they have to go to some of the traditional ADA services that have been doing this, for many years already.
Yeah, it's really exciting to start to think about. And I think, for us as in healthcare as a whole, and especially in addiction treatment, like really starting to get this technology to work for us and to do these things for us, right? It's felt, at least for me, like we've worked for the technology for a long time. Maybe this starts to shift that, Michael, in that way that you're talking about. And that could be very exciting.
Yeah, I'm hopeful. Let's see. So we could go back to the other poll if you'd like to, and that might be a way for us to finish off here.
Yeah.
I know.
So this poll, you want me to read this one off, Michael?
Yeah, sure, if you'd like to.
Yeah, so this poll is just in regards to telehealth. We were just looking to see what you were most excited in. And this is relevant for us too, because this gives us a chance to think about future trainings and support to you all out there doing this hard work. So we'd love to know, is it, Nick, we'd love for you to talk more about the organizational component of it, or maybe the client experience or the provider experience, or I need more of all of this stuff. We've done trainings that focus specifically on skill sets for providers. Like, Michael, I'm going to shift right now in how I'm talking to you. That's a telehealth skill set where I'm awkwardly looking at a blue light on a camera, but for you, that experience may be a little bit more different because I'm looking maybe at you versus my screen right now. So like those are some fun skills that we can talk about maybe in terms of how do you really start to fine tune some of these telehealth skills. So our poll results are back, and great, I love it. So we need more of this stuff. So all of it, it really looks like most of us really would love more support around all three components of organization, client, and the provider experience. Thanks for the feedback on that. That's helpful to see.
Well, that is terrific. Well, so Nick, thank you again for sharing this with us today. We do have just a few reminders for our participants today. Again, our staff here will be reaching out with an email to provide a link to the video for on-demand access. Please complete the brief certificate, and we do have the brief survey, and we do have a certificate of attendance for you all here too as well. I believe that is about the end of our work, except we do want to again acknowledge our sponsor for today, HRSA. I know you're doing some work with them as well, Nick. Fantastic work in the field, and they are sponsoring this particular project in part. So appreciate our folks at NORC and all the people who are doing great work around here, and Nick, especially for your time today, and to all of our participants.
Thank you, Michael. Thanks, everybody.
All right, have a terrific day, everyone.